over briefly the coalition goals and membership that we've established previously and review that with you, and also to introduce our steering committee. And then we'll talk some about what our plan is with the resolution we have been talking about, and give you some feedback about what you told us, and also have a breakout session where we hear all of your voices, and we're really looking forward to that more interactive session. And then we'll close with a wrap up and next steps. If you do have a question, go ahead and raise your hand as we go, or ask it in the chat. You'll get a quicker answer if you ask it in the chat. So, Bistra, did you want to introduce yourself?
Yes, good morning, everyone. Thanks, Amy, for starting this meeting. I'm Bistra Jeleva with Children's Heart Link, an NGO that focuses on building capacity and advocating for pediatric and congenital heart services. I am also the co-chair of this coalition and of these efforts. And so Amy and I will lead you through a presentation today, talking about the initial thoughts. We had a meeting about it in January, for those of you who remember, and we wanted to kind of start some of the discussions. Thanks, Amy. Okay. You can continue.
Thank you. Next slide, please. So as many of you recall, the Global Coalition for Pediatric and Congenital Hearts grew out of the efforts around the 8th World Congress and the call to action which we created at that time. So many of you signed. There was a call to action calling for immediate action to improve access to cardiac services for those affected by congenital and childhood onset heart disease. And then the goal of this coalition growing out of that is to create an ongoing effort. So we know we created the call to action. That's great. We know it will only make action and create change if we continue to work on using it as a tool to change policy and investment. And some of you were involved. We did make visits at the time of the World Congress to agencies like the USAID, the World Bank, and also a number of ambassadors. And just to note, this Global Coalition for Pediatric and Congenital Hearts is hosted by the Global Alliance for Rheumatic and Congenital Hearts and Children's Heart Link. Next slide, please. So we sent out an invitation, as you may recall, after the last meeting, to invite people to join the coalition. We sent it to everybody who signed the call to action, and we had that kickoff call in January, and then we had a survey. So we asked people what they wanted us to do. Right now, we have 124 members from 44 countries, which we're very pleased with. And you could sign up both as an individual or as an organization. So right now, we have 80 individuals who have joined on their own. We have 44 organizational members. And of those 44 organizations, I'll just note that 28 of them are patient and family organizations, which of course is what Global Arch does, is specifically focus on engagement of patient and family groups and leaders in advocacy. Next slide, please. So you may recall that we asked you on the survey different questions about what you wanted to be involved in. And this is a chart that just briefly shows what you all told us. So one of the questions was stakeholder engagement, and that means directly engaging in these kind of high-level advocacy meetings. So collectively advocating at high-level gatherings for the development of sustainable, lifelong pediatric and congenital care services, including standards and policy development. And we also think it's very important that we bring the perspectives of low and middle income countries and communities into the global conversation. And by far, this was the answer that most of you gave us. This was the thing that was most of interest. The second topic that was of interest, sort of most interest, was research. So this was not clinical research so much as developing and mapping, looking at what's out there promoting a common understanding of gaps, and advocating for these to be addressed through the coalition's membership and other relevant actors. So we all know that when you do advocacy, your job is to make a case to government and also to know what the problems are. And so we need to make sure that we have a really good understanding of what's out there, what the information is, and also what gaps exist that we can fill. This was of high interest of the group as well. The third area that you all wanted to help us with, which is great because this is a major area where we will all need to work together, is communications. So this is both developing specific advocacy tools and materials, and both Children's HeartLink and Global Arch have worked on some of that already. We have resources, but really honing and refining our resources, creating them for different audiences. Also to engage in virtual and in-person events, which some of our member organizations are already helping with, and engaging with media channels to streamline the messages at the country or global levels and provide a platform to gain visibility. So collectively, all of our organizations and all of our voices can help get that message out through every channel. We also asked about fundraising and personal financial contributions, and we were very pleased to see that a significant number of you both said that you would be willing to work on fundraising and actually were willing to make a personal financial contribution. As all of you know, this work takes money, and this is money that is often very hard to raise for advocacy. And so we were very excited to see that there was some willingness to help with this. And we certainly will be following up in terms of supporting us as much as you can. The costs of this, which are being supported by Children's HeartLink and Global Arch right now. Next slide. And before I go into more information, I did want to pause and just note and thank that a portion of this work is made possible by Noemi DeStutz. Some of you may have been lucky enough to know her. She was a founding member of Global Arch. She was really a trailblazer. She was a person living with complex congenital heart disease who became a medical doctor and then was very active. And her specific interest was really moving the needle and always having it be from the lifelong perspective. Everybody here has the same goal. We don't want to just save babies. We want to make sure that everybody lives a long and healthy life. And it was her legacy donation. She passed away about a year ago. We miss her terribly. And she was the person who really helped us initiate this and get this going in terms of her generosity. Next slide. So one of the things that we did is we created a steering committee for this coalition. And just to start out, and we've talked about this before, so the way this coalition is structured, it is co-led by Global Arch and Children's HeartLink. And we are two organizations that have a history from our founding of working closely together. And that is very embedded in the philosophy of the two organizations. So we believe strongly that effective care and advocacy comes from a partnership between the patient family voices and the clinical voices. Those are the two parts of this puzzle, and that's what we do, and we do it in advocacy. In terms of the steering committee rules, we decided that there should be a maximum of 8 members with 2-year terms for the first time through. So we understand that as we go, we will have different goals in terms of the specific thing that we want to achieve as a coalition, and that our steering committee should be aligned with those goals. So we have appointed a steering committee for this coalition for their first term, and we made sure that there were 3 voices well represented in this committee. So we wanted to make sure that the patient and family organizations and those patient family leaders had a significant seat at that table. We wanted to make sure that non-governmental organizations, the humanitarian groups, voices were there. the academic institutions that support this work and are very active in policy engagement, and the professional societies. The other criteria we had for them is demonstrated leadership and advocacy and leader engagement. And to be very concrete, ideally that would be working specifically on policy or investment. So beyond awareness, really working in this specific space on investing in this kind of thing. And then finally, essential to this is those with experience collaborating or working in low and middle income countries. This initiative is focused on low resource settings, and we wanted to make sure that our steering committee members robustly represented those communities. Next slide, please. And these are the people that we have appointed. We're very, very pleased to have them. In addition to Bistra and myself, we have Anu Gamanju from Nepal, who is a person living with rheumatic heart disease, also works closely with the WHO as a voice for people living with disease and also a global health professional. We have Christopher Hugo Hammond from South Africa, who also has been, is a clinician and has worked as an advocate in this area for a very long time alongside Liesl Zoka. They were very essential in passing the rheumatic heart disease resolution, which passed a few years ago. We have Dr. Anita Saxena, who is a voice from India, who has been very involved in both CHD and RHD. And that voice from that part of the world. We have Dr. Gary Schuller, who has worked closely in Australia. Australia was the leader, one of the leaders in the RHD resolution, and we wanted to get feedback from that perspective of working with that government. We have Dr. Jeff Jacobs, who initiated the Global Village at the World Congress. And then we have Martha Numbo from Namibia, who is a person living with CHD, a patient advocate, and has been very directly engaged in Namibia with engagement with the government. So that's our steering committee, and we're very pleased to have them. Next slide, please. So now we're going to switch over to Bistra, who's going to talk very concretely about our goal of the Assembly resolution. So Bistra, take it away.
Thank you, Amy. So what we discussed with you in January when we first met and when we came up with the idea of this resolution was to, this coalition, was to work as a goal, as a group together to help pass a resolution for pediatric and congenital heart disease at the World Health Assembly. If you can click one more time, please, on the slides. So what is a WHO resolution? One more time, please. Yes, exactly. So we see all the text. So the WHO resolution, as you can see here on the slide, it's an agreement by all member states of the WHO and the United Nations system, which WHO is part of the United Nations system, committing to do something together. So in this case would be a formal agreement or a decision by all these member states, political commitment on a specific health topic. The World Health Organization is the organization that brings together all the different ministries of health of around the world, of countries around the world, and they regularly pass such resolutions on different topics. Basically, it's countries agreeing that this topic is very important. They reach some sort of a consensus with this document and agree of what needs to be done. So these resolutions are important documents because they have political weight. They can be used domestically by governments to run policies and to create new policies for that particular topic. And they typically get agreed on that they will be put on the agenda in the beginning of the year, which is in January. And during the annual meeting, which happens every May, during the annual meeting of the member states of the World Health Organization, is where those resolutions get voted on. You can go to the next slide, please. We have actually spoken to a lot of other organizations and coalitions that have passed such resolutions and are trying to learn from their experience and apply those lessons to what we're trying to do with this coalition right now. Amy alluded to for example, the WHO resolution on rheumatic heart disease, which was passed in 2018, again, by a collection of organizations and individuals who really cared about rheumatic heart disease. And in that resolution, basically, governments were committing to improve programs, to organize policies in different countries around rheumatic heart disease, largely prevention, but some, I guess, management as well. Another example is the resolution that was passed just last year to a large-scale food fortification. This particular resolution was actually to prevent the some birth defects that occur from a lack of food fortification or specific micronutrients in the food around the world. And I think specifically what they're trying to address is prevention of spina bifida. So these are just a couple of examples. We've spoken and researched other efforts that are happening. Resolutions get passed every year on different topics. Just go on the WHO website and you can see, as well as you can see what every year the countries vote on. Next slide, please. So again, we are here together to be discussing how we can get past the resolution on pediatric and congenital heart disease. We don't even know yet what the name of that resolution is going to be and full focus, but what our advocacy wants to be is that this resolution should focus or should be based on the call to action that I believe probably all of you signed on. The call to action that we started during the Washington, D.C. World Congress for Pediatric and Congenital Heart Surgery, which happened just this past summer in August. And in that call to action, and we have shared this with you, but we'll share, it's the base document for our efforts here. In that call to action, we made recommendations for governments, multilateral organizations, funders, professional societies, different stakeholders in this field in these 4 categories: increase capacity to care for people with pediatric and congenital heart disease, build the pediatric and congenital cardiac workforce, closing the data gap, something that Amy talked about a little bit earlier, is getting more data and research to enact health policies around these conditions, and finance pediatric and congenital cardiac care, which is a very important topic to all of us working in this field. There is not sufficient government financing for it. So what we hope is that resolution will have commitments. The resolution will have commitments around these 4 areas based on what we've asked for in the call to action. Under each one of those categories, we actually have made specific recommendations of what needs to happen. The call to action has been signed by, I believe, almost 1,500 people, no, over 1,500 people, different organizations as well. It's actually still open for signing. I think it's our base advocacy document. And our hope is that all of that text will translate into the resolution. Now, the resolution is a government policy document. It has specific type of language, and it will look a little bit different, but we want this to be the base of it. Next slide, please. So we wanted to now, as you can see, we had a very quick presentation of our ideas. And for those of you who are here, I know not everyone was able to make it to the meeting, but to start an open discussion of what do we think absolutely needs to be included in the WHO resolution focused on pediatric and congenital cardiac care. We should be thinking about what events we should be advocating for and how to move this forward. And how would we engage patient voices in your country to support a resolution campaign? One more thing to add. Our goal is for this resolution to be passed in 2026. So we have some time to focus on these events to help socialize this idea. But our very first steps need to be of getting some governments and some ministries of health to support this. And this is what we are already doing as a group with the steering committee, and what Amy and I and our teams are working on, to start talking to different ministries of health and try to understand, is there an interest to bring this forward? Because we as a coalition cannot bring anything forward. We can make suggestions, but any discussion items that are brought forward to a WHA, World Health Assembly, is done by member states. Member states who are working in the UN and WHO system. So however, we as a coalition have a tremendous reach and great voice. And that's what we're hoping that we will be able to do through events, through potential publications, through discussions, attendance of meetings, and getting governments to be interested in this topic. And again, at this point, we want the basis for our resolution to be the call to action. Amy, go ahead. Are you muted?
Thank you, Bistra. I did, just in terms of managing expectations, I did want to add another, at least to me, a very key point, which is when this works, this is if anybody here has worked on a piece of legislation in the US, it's the same way. Essentially, as Bistra said, we tell people what we want, we might even write a draft, but once it's in the health ministry's hands, they can rewrite it. So just to be clear, we will start with what we want. And then at the end of this process, this could be quite different than we planned. So we're confident that it will be focused on the general area and include these goals. But as it goes, it's possible that it'll narrow and, it'll change a little bit. So just understanding the process, that once we get a government to introduce it or to commit to working on this, then we lose a significant amount of control. So when we talk about what we want to see included, that's just important to keep in mind, that we start the draft and then it goes into the blender and comes out the way it comes out.
Yeah, absolutely. Thanks, Amy.
So I think at this point, we're breaking into breakout groups. You will be automatically assigned a group. We've got 4 groups, I believe, working, and we're going to make a real effort to ensure that everybody here has a voice. So think about what your answers will be for one of these 3 questions or all of them. And we should go ahead and go to breakouts.
Thank you.
Okay. Hey, because you're the host, I need to move you.
Here,
Hey, you.
I can just join. I'll just join.
Yeah.
Room 1.
Yeah.
Oh, wait,
no, you're on 3. You're on
3. Okay.
Mhm.
I'll join right now.
Okay. Hello, Najama.
Yeah, hello.
Hi. On your
Hi.
It should
I
have,
am from Pakistan, Karachi, Pakistan.
yes.
Uh,
Did you receive a request on your phone, on your screen asking you to join?
Sorry?
You should have received something on your screen that asked you to join.
Okay.
It would have said to join a breakout room on your screen.
I just see the names, doesn't anything else.
Okay, one moment. Let me try to send you a new one. Let's see.
I can see 4 squares, not
Okay.
5.
I'm gonna go ahead and move you to your group right now. Okay, it looks like you actually declined the. One moment. Oh,
go to the first. Hello?
Hello.
Yeah, please, can you redirect me to the group activity? That is not the
Yes.
range.
Do you remember which group you were in? Sorry.
I'm not sure. I was in and then my network, so I went out.
Okay. Do you remember if Amy was in your room or Bistra?
I don't think I can remember the moment we went there, so I was struggling to reconnect, and I've been able to connect now.
Okay, I'm gonna go ahead and put you in another room then. Okay.
Sure, that's fine.
Mm. Hello? Hello? And again. Hi, Visti. Is everything okay?
It's great to see all of you back here. And I think we had a really good conversation in our group. I hope that all of you did as well. So I'm going to call on people in turn to share what your group talked about in terms of those 3 questions. And I'm going to start with Katie. Katie, can you report back, or was it Kate who was facilitating? My apologies for forgetting.
I'm in group 1, so I'm happy to go.
Great.
And for those of you who I didn't meet in my breakout group, I'm Katie Kraft. I'm the advocacy program manager at Children's Heartland, working closely with Bistra. So our group had a great discussion. I think we talked about needing to make sure that there's data there to back up the asks that we're making in the resolution. And so whether that's cited in the resolution or it's part of those educational materials, that would be really important. Also talked about, as we're thinking about writing a resolution, thinking about the varied needs of different governments, right? Low and middle income countries, vary in terms of what their needs are in this space. And so doing some mapping about, who is investing in this space and what they're doing and what level of care they provide, and also what they might really need as we think about that holistic approach. We also talked about the World Summit that's happening in Italy in the next few weeks. James mentioned that he's doing a talk about globalization of data. And so maybe that's an opportunity to talk about our resolution in the future. And then also talked about wanting to present as a coalition at our data and our sort of case at meetings with public health professionals and in sort of engaging our peers in this effort. We then went back to talk more about what we wanted in the resolution. Definitely agreed more financing, availability of data, and critical training capacity for pediatric cardiac care. And just looking here, talking about involving patient advocacy groups. We talked about how we really want them in meetings with government officials to be pushing for this resolution, and also wanted to make sure that patient advocacy groups are getting the direction and the support that they would need to engage with this campaign, because that can be a challenge. And then finally, talked about accountability in the resolution, that wanting to make sure that we don't just pass a resolution, but there's some accountability that governments actually implement the policies that they say they will, and recognizing that when economies are hurting and things are going on in the world, that health services are often cut quickly into that. And so want to keep an accountability mechanism there. Folks, group 1, please add anything that I've missed.
That's excellent. Group 2, would you like to present?
Was that our group? I'm sorry, I didn't remember the number.
Why don't you go ahead, Bistra?
So we had a conversation about several different things. First was seeing what government representatives we're talking to and understanding what they're interested in, and developing, bite-sized talking points for people we're addressing. So that's, I think, a very important comment. We discussed that data that drives change would be very needed. Who is being served, who is being left behind, and I would call this advocacy type data. Talking about understanding what prenatal screening would be available in different countries, because we had someone represented that point of view. In terms of meetings that we could be presenting with would be neonatal association, nursing association, or obstetric health neonatal specialists as well, understanding that neonatologists would be an important group to sensitize and to bring on as advocates for this topic, because they are the ones that also can help save lives and early on in children born with congenital heart disease. Finding champions, I think that's a very important topic in terms of, from experience in the United States, that we always needed to find a legislator champion, someone who can drive this agenda. And so we did discuss briefly, are there governments that would be that we could bring on board, that would be our champions. A suggestion about reaching out to someone like Jimmy Kimmel. For those of you who don't know him, he is a TV personality in the United States, and he has a child with a congenital heart defect that he has spoken about openly. And so he has a daily show on TV, and possibly bringing that, reaching out to him and asking him to speak briefly about this on his show would bring attention to our issue, which is not a bad idea. We also talked about, one of our discussions focused on sudden cardiac arrest, and discussing how that's not made a priority and hasn't become like our issues are not become an urgent issues. There's no urgency around it, even though we have high mortality, we have a big burden that people are just not discussing, and it's not just coming forefront to the agenda like some other issues that may be actually less dangerous. So those were the thoughts from our
Great.
group.
Thank you. Group 3.
All right. Hi, everyone. For those I have not met, I'm Kate Doherty-Schmeck. I am the Executive Director of Global Arch. I may have met many of you in the past. When I was at Boston Children's, I led the International Quality Improvement Collaborative for Congenital Heart Disease and other international collaboration. So first, thanks for everyone in my group for sharing their feedback, either vocally or in the chat. Everyone made sure that, any technology didn't stop them. So thank you for that. Some of our takeaways were what to include was the importance of lifelong care for both physical medical care and also mental health, most importantly, and also of really full multidisciplinary care, making sure that a surgery just not just fix it, that it is lifelong care and the importance of that, as well as the early detection. In the resolution, also making sure we address access. So access for every patient around the world that is impacted, as well as making sure that there is supplies available, including, medications and other medical supplies, as well as the staffing, making sure that the staff feel supported in their work to deliver care. To really help engage more, it was suggested doing some, TV interviews as well, and really making sure the presence is known from the chairs and the individuals who are involved in this work, really making sure we approach social media more and incorporating that. And also a big takeaway was hearing the patient's voice and the patient and family's voices in this work and their stories, and that they're on the forefront of all of the work that we're doing, and most included. And then for those areas of the world that don't have patient or family support groups, that we help to really help engage them and to help start, which I will briefly mention is that is a goal of Global Arch, and something that we do is making sure that every patient and family and those impacted by pediatric, congenital, rheumatic, other heart diseases are supported in their care. So those are the biggest takeaways.
Thank you.
Thank you, Kate. In terms of our group, again, it was a great discussion. Thank you so much. What to include in the resolution, a lot of echoing of what's been said, the importance of data, that's really key, and the note that might be a cheaper ask for government. And then the comment about workforce, that this is critical. That came up as another priority, and actually there's a new global coalition being started to focus specifically on global education, which is great, and we can partner with. And then this issue of supplies, that when you look at capacity, it's not just the hospital, it's also all the ways we can improve access to the stuff that people need. In terms of the patient engagement, which is very bled into in our group awareness, one of the points that was raised, which is really good, is to make sure that we're not just talking about patient and family, but also local champions. One of the groups that we had works extensively with an organization that's on the ground who just work for health in their area. So there's always going to be local engagements. The milk company was also really good. So when we think of specific countries, obviously it's all your champions, that this theme of closing the gap between the providers and the patients and families, that can be a very big gap, and that again, this would obviously be something that would be a focus for Global Arch, is really promoting those connections and promoting the creation of the groups. That stigma came up in our groups, because that is a huge issue in many countries in terms of a barrier from patients and families speaking out. They don't want to be advocates because that's a really scary thing. And so making sure we have those connections. I think the other thing with awareness is we all talked about just making sure that our organizational members were invited to sign the call to action, that's a great place to start. And I think that's everything from our group. Anybody have any final comments or anything I left out? This is great feedback. All right. So Bistra, I think this is quickly to you.
Yeah. So we appreciate everyone coming here. I just want to assure you that this coalition is larger than the group that we have represented here. We have had many people sign on to it. And I think Amy presented that at the very beginning, but we will be hosting calls like this and give people opportunities to give input of what we're trying to do. Again, this Global Arch and Children's Heart Link, and in the face of Amy and I are chairing it, but we want this to be a representative of everyone who has signed on to be part of the coalition. So what we will take time to work on over the next 3 months, 4 months actually, is to develop some of those materials that were mentioned, materials that we can be using to bring to decision makers, whether those are governments directly or people who can influence governments, to develop talking points, to develop advocacy materials that we can start using to socialize the idea of this WHA resolution with people who will bring it forward. And when we develop them, we actually would want to have this community, all the members of the coalition have input in that as well. Again, I want to stress that they will be around the call to action and everything that we have suggested and people signed on to the call to action. Also, the call to action continues to be open for signing. So if you are talking to somebody, you should definitely encourage people to sign it, because the more signatures we have on it, the better. But we hope to launch some of those material in September, and then think about what kinds of events then we can, whether those are webinars or in-person events, think of a format that all of us can use to use those documents and to use our asks in, again, socializing the idea of a WHA resolution. So we'll take the next 3-4 months to work on that with input from the coalition members. And you're muted, Amy.
Just quickly, I just want to note that we will be, a number of us from Global Arch and Children's Heart Link will be in Geneva this month at the WHO Health Assembly, and we are having a side event which is co-sponsored, and we'll send you out the information. But that will be a great opportunity to talk to people and continue to identify who can be our champions.
Yes, of course, I should have mentioned that.
And actually, and you can watch this. It's going to be live streamed, so you will get a registration link.
One piece of this is, in the meantime, we want to keep this open for questions and comments that maybe something that was not mentioned in this meeting. Again, we will have opportunity, we'll get into a cadence of regular meetings with this group. We're still early on and still trying to figure out how we're going to do this work. But if in the meantime, if you have questions and comments, please reach out to Amy or me, Kate Doherty or Katie Kraft from Children's Heart Link, or Naime from Global Arch as well. So we will share that information with you in a follow-up email of the people who are directly working on this and kind of finalizing some of the details.
And Bistra, I put the Global Arch email, the info@globalarch.org in the chat. So you can email that and we'll make sure that you're connected to anyone if you do have any questions or feedback.
One one more thing, Kate, before you go, is that we will also be creating, part of this, we'll be creating, because this is a campaign, right? We'll be creating some social media tools and ways to connect to the coalition. So the coalition will have its own social media presence. Go ahead. Sorry.
Thank you. I think that's it.
Amy, do you want, or Bistra, can you just wrap up on how else to get involved for all of our
Oh,
members
sorry,
on
Bistra.
the slide?
Maybe-
So again, keep bringing ideas and questions to us, like we just said, and we'll be engaging people individually on mapping key advocacy relationships that will actually help us with this resolution, WHA resolution campaign. And please encourage others to join this coalition, whether they're individuals or organizations. I think the more people we have, the better we'll be, and the more heard we will be. So those are my parting comments for this meeting.
Thank you. And thank you all for coming. And we look forward to seeing you again.
Thank you. Have a good day, evening. Bye-bye.
Bye.
Thank you.
Thank
Bye.
you, everyone. Bye-bye.
Thank you. Bye.